Going
morning.
live.
Good morning.
You're live. Good morning, everyone.
Hey, look at this. We're here.
Happy Wednesday, everyone.
Happy Wednesday. If you've
To-
been following us on Instagram,
Oh, yes.
everything in our neighborhood is flooding.
It's
So we
been
are
an
here.
adventure for sure. So, happy Wednesday to those just joining us for the very first time.
Hello.
We are
Welcome.
the Nursing School Show.
Yes, I'm Christina.
And I am Matthew, and we are here to answer nursing school questions.
And we always get this question.
I have a test in 2 hours. Hey, congrats.
People always ask us, who are you to each other? And so we'll just answer it up front.
Hello.
We are married. Someone asked, what was
Hello,
it the other day?
hello.
Are you
Are
what was it? Are you not related?
a couple?
Are you a couple?
Are we a couple?
Like, okay, if you're married, you're technically a couple, right? But like I consider like
Yeah.
couple being like
We are a couple.
engaged
A couple
or
of people.
dating. We are a couple of people. Yes.
Yes.
That's
All right.
funny.
Well, go ahead and
Yes.
shoot in the comments below any nursing school related questions, comments, anything that you'd like to share with us today. This is Ask Us Anything, Ask Me Anything, Ask
Mhm.
Christina Anything. How to write a soap note, please.
Yes, that is a fabulous question.
I take your questions and put them here,
Yes.
and then we'll answer them as we go.
And actually, I want to direct you. I think we have a video on it on YouTube. We certainly have things on
I think we do.
in our membership community on writing soap notes,
Maybe?
soapier.
Soapies,
There's
yeah.
various versions. Yeah, we actually have a whole lecture on it in our membership community. I think we have one on YouTube, so check it out on YouTube. I mean, I can go over it, but it's kind of nice on YouTube because I can like write it out, or in that video, like I write it out and you can see all of it. So there you go.
So go ahead, youtube.com/nursingsos, and you can search that out there. Also, if you're not yet, subscribe. Consider subscribing. Don't consider, just do it. Just subscribe.
Don't
and
consider
hit the bell.
subscribing.
And that'll be
Just
helpful because we go live every Monday and Wednesday, and all our lives are on
Yes.
YouTube as well, and all our archives are on YouTube. So
Nina's asking about
that
prioritization.
is great. Prioritization.
Good.
Okay.
Question. Someone asked, why can't we do IVs or catheters as students? You can, so long as you have like checked it off with your school beforehand. So you have to have like some level of competency before you can do it on a real life person in a real life setting, like clinical setting. So
you have clinical checkoffs, right? You need to check
clinical
it off
checkoffs.
before.
Yeah, skills checkoffs.
Skills checkoff.
You'll call it. Some schools call it.
Mhm.
And so that's when you'll check off your IV, check off your skills. And then, once you are checked off, then, depending on in your program. Okay,
not in your program.
Stephanie,
no, we can't.
You can't? That's so weird to me. I've never heard that before.
Are there
So-
simulations? Do you do?
So, like, you do it in skills lab, but then you're
Yeah.
not allowed to do it at clinical. Okay, there is also some schools, I think our school had this too. You did have to not only reach a level of competency with the skill, but also you had to be at a certain level of your program. So, like, they gave us a whole sheet that, if you were in fundamentals, you could do this at clinical. If you were in med surge, you could do that plus more at clinical. Like, you have to advance to your program because, like, IVs, sure, anyone can anyone can learn how to put in an IV, but that's very different between learning how to put in an IV and also assess your patient before, during, and after. You know, if we're talking about giving medications through IVs, if we're talking about obviously IV fluids or blood transfusions, like, man, that is not, like, if you're in fundamentals, no. You're not going to be able to have that competency where you're able to assess a patient before, during, and after. So there are those things too, Stephanie. I would probably maybe check with your school because maybe that's what it is. Maybe it's not just like checking off the skill per se, like itself, but also like, you know, you have to know the content, the content behind it. You have to know everything behind it, like the critical thinking and all that behind it. Yes. Do you know anything about the changes in the next gen NCLEX? Yes, a lot. We know a lot about those changes. we talked about it on Monday. We had a fabulous breakdown on YouTube back in August.
YouTube. We had a live back in August about the NGN, or the
Yep.
Next Generation NCLEX, and we go over the different types of questions and
All the
answers and all the changes and stuff. So be sure to check that out.
Yes. Yep. So we can also, well, Matthew will write it down.
Yeah,
and we
I'll
can
write it
still,
down.
Well, he already wrote it down because it's always a question that we get. Let's see, Stephanie, we can't do it on real patients at the hospital, but we have to practice on dummies and sim labs until we graduate. It's not allowed for us to do IVs or catheters. Yeah, that is so interesting. I've never heard about that before. Stephanie, I'm going to ask you a really random question. Is your program accredited? It's a very important question. I have never heard that before. So that's my first question to you. Is your program accredited? So that is, yeah, that's kind of interesting. Like, that's almost a red flag to me about a program. I'd be a little concerned. And I would definitely talk to your instructors about it. Like, I've literally never heard that before.
Interesting.
Yeah.
Well, go talk to your instructors and let us know what you find out.
Yeah.
RIC in Rhode Island. Okay.
RIC in Rhode Island. Rhode Island Community?
The only Rhode Island one that I know is RISD, and that's an art institute. So I don't think that's where you're going, or you probably shouldn't be going to RISD if you're in nursing school.
That's funny. Yeah, see, I'm not familiar with all the schools, or that would be crazy. State. Marford Jones, are you saying like state college? Rhode Island College. That sounds
like Rhode Island College.
Like, I would just double check.
Yeah.
Make sure it's accredited.
That's really interesting, but
that is interesting. Marford Jones is your school. Do you go to the same school? That'd be funny. And okay, everyone else on this live, do you do skills? Like at clinical? Is there anything that you can't do at clinical?
That's a good question.
I'm gonna ask our members too.
Okay.
Later.
We'll ask our members and we'll get back to you on that on a future live. So stay tuned.
Yeah, Marford Josie used to go there.
Yeah. Okay. Very cool. All right. Well, let's see. From Monday, we were going to talk about MedSurg.
Okay.
If you guys want to talk about MedSurg, let us know down in the comments below. We are also going to talk about NANDA diagnoses.
Yes, I want to do that first.
Care plans.
Care plans? Because
dosage calculation. Someone wants to talk about dosage calculation.
Let's do it.
Right here.
Okay.
So we're going to do care plans first, right?
Yes. The first thing I want to show you is this book here. If you don't have it, it's likely required by your school. So many schools require it, or something like it. Maybe not exactly this one, but pretty much all schools will require you to buy a care plan book. Now, I highly recommend that you open that care plan book right away. So it's so funny because when I started nursing school, like they give you all the textbooks, and literally it's like you basically need a hand truck to get it to your car, which is not fun. And then you don't go through them, right? Because you don't know what these books are. Like you don't want to open them if you don't have to use them. But I highly recommend that you do open your care plan book and at least skim through it, because I did not look at this book until I was probably halfway through my program, and it would have been so helpful when I had started. So it's very, very important that you understand care plans early in your program and that you can do them quickly. The quicker you can get through your care plans, just the better off your life is going to be, because there's so many of them that you have to do. For clinical, like oftentimes you'll need to do like 3 of them for each patient or 5 of them for each patient that you have at clinical. Like it's very challenging to get all those done. So seriously, you want to be able to get to the point where you're writing your care plans in like 10 minutes. That's it. Okay.
While Christina's jamming on this, let us know down in the comments below if you've done any of your care plans yet, and like what term you're in nursing school, and how this relates to you. Okay,
and also what I want to mention, should have mentioned this at the beginning. We have about 3,000 things coming for you guys. If you're a Nursing SOS member, there's just like, we have a ton of resources videos. I think I recorded like, I don't know, a couple dozen new videos that we have coming for you very soon. And Care Plans is one of them. We have some really fabulous new resources coming to help you out with Care Plans. So stay tuned. Because they can be very, very stressful, and we do not want you to stress about them. We're here to hold your hand through all of it and to, obviously help you write them so you don't have to worry about it. You don't have to figure everything out yourself. Do you have anything to say about that?
No, I think that's good.
Okay, first thing I want to show you is where you find the NANDA nursing diagnoses, because this is a huge question we get.
That's like the second page.
It's the second page. So go to your care plan book. You've got a list in your care plan book of all the NANDA nursing diagnoses. Okay. We always get this question because in your textbooks, like if you're just going through your fundamentals textbook or your med surg textbook, they're like scattered all over. There's no like comprehensive condensed list of them in those textbooks. What you want is your care plan book. All right. That's where you're going to find it. The whole list of NANDA nursing diagnoses. Okay. So that's all there. This is the book. Okay. And then as you go through, basically, it writes your care plans for you, which is fabulous because it goes through each of the diagnoses. It gives you the patient goals, the nursing interventions, the rationales for those nursing interventions, the as evidenced by, the related to, like all of the things. So when you think about NANDA nursing diagnoses, when you think about care plans, think about this book, okay? And then follow me on Instagram because, well, we're going to tell our members first. If you're a Nursing Essence member, watch your emails because we're going to tell you some fancy things in the coming weeks. But then on Instagram also, I will post them on my story. So when we get those care plan resources out for you, I will tell you because it's going to be.
Christina's very excited about this.
I'm
if you
very
have not
excited about it. Yeah.
Caught on,
Yes.
But also, I don't know. I find this fascinating, and I'm not sure. Maybe nursing students will know this right off the bat. But again, not a nurse, so I'm just going to ask the question as if I don't know because I do not know.
Go for it.
The whole idea of NANDA diagnoses or diagnosis is that NANDA, it means it's standardized, and that's why Christina says that there's a whole list right in front. Like you don't just make up your own diagnosis.
No.
So don't do that if you're doing that.
No, don't make up your own diagnoses. You will fail in your care plan.
Yeah,
because that's not allowed.
So the whole list is in the front of that book.
Can you see this on YouTube? Instagram, you asked what is the name of the nursing care plan book. It's Nursing Diagnosis Handbook by Ackley and Ladwig. Oh, YouTube, I hope you can see it.
Yep, you can see it.
I can see it. Can't see Matthew. Can see the book though. Nursing Diagnosis Handbook by Ackley and Ladwig.
And then also on YouTube, for all those on YouTube, or if you're not, go there. The YouTube this week was not about it, but like the past 3 weeks have been examples of care plans. So if you need more guidance, step by step, go ahead and look at that. It will. Christina literally goes through each of the columns of the care plan and what to put, or some examples from each column, how to do it. So yes, definitely check that out.
Yes. Okay. Does the Nursing Diagnosis Handbook help with the SOAP note? I have purchased the book. It totally could. I mean, the thing with the SOAP note, you use it for documentation. Care plans are technically documentation. I mean, you guys know that like when you graduate nursing school, you're never going to see a care plan ever in your life. Like, you know that. Because like charting and stuff, yes, while you're kind of charting your care plan, you're not like charting it in the columns. You are basically doing like, that SOAP note kind of thing, depending on like how your clinical site or your facility charts. So it could be like, I say most things in my world are on Epic, for the like computer charting, electronic charting. And so you do like your assessment, right? So like the SOAP note is like subjective data, objective data. What's your assessment? What's your plan? And so you do like your subjective, objective data, what your assessment is, kind of. That would be like, here's my assessment, here's what I think. So if you're talking to the doctor, that's like, here's what I think, here's what I want to do, kind of recommendations kind of thing. And then here's the plan. Like, here's what we're gonna do. So it's kind of similar to a care plan because you have the assessment and you have the plan, but they are not the same.
They're not the same, but even looking further, like you mentioned soap note. Do you stop at the P, or do you have the soapy
There's
or
more.
the soapier as well? Because the I and the E and the R kind of
Yes.
dovetails more into the care plan, right? With the
It does. I
intervention,
mean, basically,
evaluation, right?
what they're getting at is the nursing process.
Yeah.
So the soap note, soapy, soapier, whatever you want to call it, it's the nursing process, really. We assess. You got your diagnosis, and the care plan, too, is the nursing process, right? You diagnose your patient. Not a medical diagnosis, the nursing diagnosis, okay? And then, it's ADPI, assessment, diagnosis, planning, implementation, and evaluation. It's basically the soap note, or soapier note.
Yeah.
I don't know. It's confusing with all, like, the different variations, and some schools use this, some schools use that. What are you gonna do? But, like, soapier is, subjective data, objective data, assessment, plan, and then, like, your interventions or implementation. I like to link those two together because they're kind of the same thing. And then evaluation, and then, like, recommendations or, like, re-evaluation. Some schools do it different ways. So check with your school with whatever they want you to use. But that's basically the care plan. You're totally right.
Yep. Which is, like you said, which is right too. It's basically the nursing process.
It's all the nursing process.
Yeah, it's all the nursing process. So get that down and you'll be good.
Yes, absolutely. Yes. So we mentioned it before, but I'll mention it again. If you're a nursing assist member, we have full, like, video training lectures on documentation and, like, on patient charting and the soap note, soapier, that's all included in that. So you can check out the fundamentals course. We have, like, a whole section on clinical documentation and charting. So if you are confused about that, how to write a narrative note or how to write, like, all these, like, types of things, definitely check that out inside the Nursing SS membership community. Gonna help you so much. Like, y'all don't have to be confused about anything because we walk you through all of it.
Definitely.
We got your back.
Okay.
Jack.
Next up.
Let's
see. We can either do dosage calculations or med-surg.
Oh, let's do med-surg because that's the older one.
Med-surg.
And I also want someone asked about prioritization.
Yes.
So I'm going to talk about those two things together.
Okay.
Let's jam. So, we call this. So, you guys, we have very specific ways of teaching you how to pass nursing school. Like, these are not things you're going to hear other places. Like, we have our very specific and defined frameworks for how to study, and they work.
The nursing SOS frameworks.
Sounds so fancy. So, this one is called the 4 core method. All right, I want you to remember that. Remember the 4 core method. There's 4 things that you need to study anytime you are studying a disorder, a disease, anything in nursing school. Okay, pathophysiology, signs and symptoms, nursing assessment, and nursing interventions. All right, now we have more things coming on this inside the Nursing SS membership community too as well very soon. So if you're a member, stay tuned. It's going to be so helpful. So that is the 4 core method, and I'll show you how it works. You start with the pathophysiology, always. The pathophysiology is really the foundation for everything else that you have to know in nursing school. Nursing school is not about critical thinking, as you know, or not about memorization, as you know. It's all about critical thinking. You have to know how to critically think in nursing school in order to pass your exams. The problem is that textbooks, your lecture class in school, YouTube videos you watch, other whatever things you do online to get help with nursing school, like, all of them are so focused on memorization. Not helpful for you. So we're not here to just give you a list of things to memorize, like a list of signs and symptoms or a list of nursing assessments or whatever. That is not helpful for you. What you need is to understand the pathophysiology first, and then you can critically think through everything else. So that's why we call it the 4 core method. There's 4 core things that you have to know. Patho, signs and symptoms, nursing assessment, and nursing interventions. Okay? It starts with the patho. Pathophysiology is always first. You have to understand what is happening in the body and why those signs and symptoms could be created. Why we do the nursing assessments the way we do them. Why we do those nursing interventions the way we do them as they relate back to the pathophysiology. So this is exactly how we teach inside our Nursing SOS membership community. We connect everything back to the patho. We do the critical thinking for you. We walk you through what you need to know to pass your exams, like all that critical thinking. That is what we do. So it's called the 4 core method. Don't forget that, okay? Do not waste your time in nursing school studying like random things about random things. Those are the 4 key things you have to know. All right? And so that is your basis for med-surg. Now let's talk about prioritization. 3 principles for prioritization, okay? The ABCs, always. All right? Airway, breathing, circulation. Those are always your number 1 priority. Okay? Safety for your patient. The ABCs. Now the next one is Maslow's hierarchy of needs, which is very similar to the ABCs. If you've seen Maslow's hierarchy, it's like a pyramid, right? With the, I don't know what you want to call it, like the levels. The first level is physiology. You have to make sure your patient's physiological needs are taken care of first. Those are the ABCs. So that's why it's first, okay? So you've got physiology, and then the next one up is safety needs. That's most likely where it's going to end on your exams for you. Sometimes if you're on like a mental health exam, then you'll go into like the, I think the next one is self-esteem, love and belonging, self-esteem, and then self-actualization, something like that. But most often you're going to focus on the first 2 bases, basically, the physiological needs of physiology, and then the safety needs. So making sure that your patient is safe, like they don't have their IV cords wrapped around everywhere, that their bed is low, locked, they have their call light, those things, right? So remember those 2 principles. Now the third principle, like we talked about earlier, is the nursing process, which starts with the nursing assessment. So I want you guys all to remember this for your exams, okay? Remember this, what I'm going to tell you right now. Anytime you are taking a nursing exam, look at the answers. If it's a priority question, like what would you do first? If it's asking you, what's your initial action? What would be your initial response? What would be your first response, your first action? Those are phrases you're looking for in the question. Go through the list of answers and make sure that there's nothing to assess for. Before you do anything, before you do any nursing intervention, before you do anything to try to fix the problem, make sure that you assess your patient first. This is so common. So let's say like you have a patient who appears, this is so common, you guys. Remember this, please. If you get a question that says like, your patient is having difficulty breathing, or like says they're having difficulty breathing, one of the answers could be like, give albuterol, give oxygen, da-da-da-da-da.
Tell
like,
the doctor.
Call the doctor.
I like that answer. It's also never right.
And don't call the doctor unless there is absolutely nothing else you could do, okay? That's another tip. So if you have a question that's like, your patient says that they're having difficulty breathing, oftentimes the answers will be like, give oxygen or give a medication or whatever. Make sure that there's no other option before you actually do an intervention. We're looking for an assessment. What can you do to assess your patient? All right? You need to look at how they're breathing. You need to assess their oxygen levels, right? You need to just assess their respiratory rate, right? Here's another big one. Giving a medication. Anytime you give a blood pressure medication, cardiac medication, make sure you assess their blood pressure and their heart rate first. All right? So these nursing exam questions are tricky because you want to do something first, right? Like you want to do something right away to fix the problem. But that's not the nursing process. We want to make sure we assess our patient first so that we actually know what's going on. Not just this gut reaction, right? Of, oh, I need to fix something. No. Assess your patient first, right? Everyone square on that? Are we good?
Good.
I like it. That was really helpful. Sorry, guys, Matthew has a cold. He's recovering. So we
Excuse
have
me.
not only flooding in our neighborhood, but also everyone's recovering from the sickness.
The sickness. The
I know,
sickness
it's
is going
got us.
around. I think I'm the last one though, so
He's
hopefully
always
we're almost
like
done.
so healthy, and then I mean, I was actually really surprised that you even got sick this time because you.
I thought I was gonna
Don't
get away
know.
with it. But
Yeah, it went through
Nope.
everyone in the family first,
Okay.
and then it hit Matthew.
Hey, everyone's
Hardcore.
saying this is helpful, so
Oh, good. I'm
awesome,
glad.
excellent.
Yay. You know what? I'll probably post about it on stories later today.
Yeah, excellent. So MedSurge, the core 4, and
Four core methods,
prioritization, all the different ways of going through prioritization, and
Yes.
Maslow's, right?
Yes, 100%.
His hierarchy.
So I think what we're gonna do next Monday.
Hmm?
I really like the question that we got on Monday. I study every day and I know the info, but I'm still not getting the exam grades that I want. What can I do? And then also like how to prepare and test taking strategies. I really want to go over all of that on Monday.
Okay.
Does that sound good?
Yep, we can do that on Monday. Let me make
Yeah.
a note.
And you guys, I want to mention, okay, well, I mentioned it a little earlier, but we have about 15,000 things coming for you inside the Nursing Houses membership community. It's going to blow your mind. So if you're a member, stay tuned, keep an eye on your emails, keep an eye on my Instagram. Man, I am so excited. We have been very hush-hush about so much for months. And so we just have like so much coming for you. And also the membership community is open, what, in a week and a half?
Yeah, it's coming up. So definitely, if you're not a member,
What's the
go ahead and go to nursingschoolofscus.com/join.
Or the link is in my bio on
Yes,
Instagram.
there is
The
a
26th.
VIP list you can join and be the first to know when it opens, so you can be part of the changes and all the additions that we're adding to it.
Yes, you're
Actually,
gonna love
one
it.
of the things that we talked about on this live is actually one of them.
Mhm.
It's our frameworks and putting names to them and
Yep.
making sure that you guys know. So core
And a
core,
whole bunch
right?
of care plans and
And
stuff.
then a bunch of care plans. So yeah,
Yep.
we actually talked about a couple
So
things coming down the pipeline.
the 26th enrollment will open on the 26th. Save the date. You're not gonna want to miss it. It's gonna be so great. Like all the resources we have coming for you. Oh, you're gonna love it. All right, my friends. We will see you on Monday.
All right, take care, everyone.
Monday. And then we'll answer these like study strategy questions because we have a
Yes.
list. So yeah. Fabulous.
All right.
Okay, friends, we will see you on.
So many diseases. Couldn't remember every patho signs and symptoms. Could you give me some tactics?
Yes, go back and watch this live because we talked all about it.
Yeah. So
Haha.
definitely, it's just the high level. It's like building a building. So you need a good foundation, and a foundation is a patho. So understanding what the body is doing and what
Yes.
it's supposed to be doing and not doing right, that'll help you
Because-
critically think.
Okay, that's the thing, you guys. When you go and watch a random YouTube video, when you go look at your textbook, notice this week. It's all lists. They just want you to memorize a list of signs and symptoms. Not helpful for you. Like, that's all I give you is a list of signs and symptoms and nursing assessments and nursing interventions. Not helpful for you. You have to know the patho first and how it connects back. So understand what is actually happening in the body, connect those signs and symptoms back to that patho. That's everything we do inside our community for you. Like that's we do all the critical thinking for you. That is how we teach. That's why the 4 core method works so well. It's because it's all about critical thinking.
It's all about critical
Right.
thinking, all about making that leap that everything is related.
Yes.
Everything connects together,
Mhm.
and understanding how one point connects to another, so you can
Yep.
make a net or make it all fit together in your mind, because your mind likes to think that way. It
We
likes
like to make
think
connections.
in connections and how things are related. So if you're just
Yeah.
going to try and memorize lists, that's not going to be helpful for your brain.
No.
So help your brain out.
It's
Do a favor to your brain and
really gonna
realize
fail you
make
on your
that leap
exam.
for that relations, and
Yep.
just understand, okay, well, this patho, okay, this is going wrong in this body, well, why? Or
Mm-hmm.
and that's really it, asking the why questions and how it links together.
Yes. 100%.
Awesome.
All right, friends. We will see you on Monday, same time, same place.
Talk to you guys later.
Have a great day. Follow me on Instagram stories because our house might flood today.
And
We'll
that will be
see.
fun to watch for you guys. Not so much for us, but
That wouldn't be fun. But
be
I'll
sure
keep
to
you
follow,
posted.
and she'll keep you posted.
Okay. Bye.
Take care.
See you later.